these things happen every single day. You're going to be all right. Say to yourself, I'm alive and these are going to fix me. They are.
You normally come in before your operation the day before. What we need you to bring with you, really important, is definitely your medication. Bring basic wash necessities. You'll have already been given a Bactroban and nasal ointment and an Octenasam wash before you come in, so if you can bring that with you as well, because you'll continue to use that during your journey. You'll just need some loose fitting pyjamas, something really comfortable. For ladies, we do really highly recommend wearing a bra after the surgery. We do ask normally for a forward closing bra with no underwire. The ward clerk will come and greet you. They'll explain where your bed's going to be and if it's ready, and they will bring you through.
My surgeon came, said to me, look, this is what we do. And they even said, look, we can't guarantee anything, but most patients live a long time if you look after what's happened, which is probably the best news you're ever going to hear.
You'll likely need to have some more blood tests. We'll normally do another ECG. You'll then be expected to be nil by mouth from about midnight. You will be given something to drink in the meantime. It's a medication called Preload, which helps rehydrate the body while you're nil by mouth for your surgery. There's a lot of preparation that goes into your skin, so we're looking to minimise the effects of infection on the skin for your wound infection. So you will be shaved, and we ask you not to do this at home because we try not to use razors. We use clippers, which helps reduce the infection rate as well. And then we'll help you have another shower afterwards using the Octenasam wash that you had already been given. You then wake nice and early, about 5-6 o'clock the next morning, to prepare again, where you'll have another wash in the Octenasam body wash.
Anything I was going through, there'd be someone come there to the bed, right, this is what we're going to be doing, and reassuring you and telling you what's going on. They explained everything really before I went down, so I was quite comfortable when I went down. I felt comfortable, even though I was scared and nervous, but I was all right. They made me feel all right.
So the consent form is a fundamental part of the preoperative process. Is the last opportunity for the surgeon and the patient and yourself to discuss about any concern, any doubts, any question that might come from the treatment that we are discussing about.
I knew I was going down. I was waiting for a time. I wanted to go down and get it out of the way, obviously, in my own mind. The porters came and I went in. I remember seeing the anaesthetist. She sort of called the nurse in and said, look. And then the nurse said to her, look, this is Tony Slavin. He's had this, he's had that. There was 3 or 4 of them working there, I remember. Lovely, just comforting you, making sure you're holding your hand, asking you about, have you got dogs at home and stuff like that, as they do. Try and take your mind off stuff. So, and then they put the cannula in and then said, look, count to 10. I counted to 2, I think, and I was asleep.
I need to put a big cannula here on your hand or into your arm. I will give a little bit of local anesthetics. And then I need to put another cannula here into your artery to check your blood pressure beat by beat during the surgery and to check your oxygenation. After that, nothing more. I will give you something to keep you nice and relaxed, and slowly you will go to sleep.
We need to make an incision in the middle of the chest, in the middle of the breastbone, to then approach the heart, or otherwise it can be done through a minimal invasive approach or keyhole surgery, which implicates a small incision on the right side of the chest. We do perform on daily basis what we call a coronary artery bypass graft. We do that on a beating heart or resting heart using only arteries, or we can do a mix in between artery and veins, and this is the most used approach.
The vein that we take from the leg, it's called a long saphenous vein, or if the patient needs an arterial graft, we take radial artery graft that comes from the radial artery from the arm.
The majority of cardiac surgery happen stopping the heart. This is happen in a very safe manner, and we deliver a high potassium solution into the heart. Then the heart will stay still, allowing us to operate and to perform the surgery.
The heart-lung machine is a very important device in our theater. It allows most of our cases to be performed safely. It will supply the heart and the lung function during the operation. The blood will be delivered to the machine. The machine will oxygenate the blood that will be given back to the patient.
We have a lot of monitoring on you to check your heart activity, your blood pressure. All these signs we are monitoring continuously, and we can titrate the depth of anesthesia according with all these signs.
At the end of the surgery, of course, we need to revert the process, and we need to reach the point when we are able to disconnect you from the heart and lung machine, and we assist the heart in the meantime until the heart return to its normal beating and its normal function. So roughly the surgery can last, I would say, 4 or 5 hours, can be sometimes even a little bit longer. And after cardiac surgery, every patient goes to intensive care unit.
When you arrive on the cardiothoracic critical care unit, you will have a breathing tube in. We'll turn your sedation off and we'll wake you up.
We'll ask you to do a few questions for us. These will include really simple commands like, can you squeeze my hand? Can you stick your tongue out? Can you lift your head off the pillow? That confirms to me that you're doing really well and that you're going to wake up nicely, and we'll get that breathing tube out as soon as we can for you.
When you've had your operation, you will go into ICU, we'll have a nurse with you 24/7. She will not leave your bedside, and to be honest, they never did. They was there all the time. You know, you're looking around and you know you're in the major bit, really. You know you're in intensive care. So all that starts to come back to you.
So when we take out that breathing tube, you will immediately be put onto an oxygen mask. We do quite a lot of blood tests when you're on the intensive care unit. We look at the oxygen levels within your blood, and if we're happy with that, we gradually just wean the oxygen down. We will provide you with something called a pain button, and it's a button that you're in charge of and you can press it yourself.
So you've got the button with the morphine. I think I pressed it 38 times in one night, I think, because it was painful. So you press your button, it eases you and you fall asleep, and it's a weird sensation.
Sometimes you can get some sickness, some nausea and sickness when you wake up. There's lots of anti-sickness medication we can give you to help with this. Also, sometimes patients do report, that they might have seen things. There are also medications we can give you for that as well. We reorientate you, tell you the date and time, what surgery you've had done, and continuous reassurance for you from the nurse will always be available.
I remember seeing like purple smoke coming from my eyes wherever I looked. I see a little 2-inch nurse run along the end of the bed, salute me. Like I've see so many things of hallucinations, And in the end, I actually was closing my eyes, seeing things, and then my own mind was saying to me, don't worry, it's just the morphine. So I was telling myself, it's the morphine, don't worry, don't worry.
You will end up with what we call an external pacing box, so we won't be giving you a pacemaker. These are just 2 very thin wires that will come from your chest that are connected to your heart. We put them there for everybody just so that you've got that little bit of reassurance if we need to support you at all. Eventually that normally comes out around day 2 or 3. We also have a couple of chest drains in. Depending on your operation, it can be different. Some patients have 2, some patients have 3. That is just draining off any excess fluid to help your chest recover quickly, and we'll normally take those chest drains out the day after or the day after that.
The most pain for me was the drains. So I had 2 drains in here, and I had one sort of felt like it was going to the front of my heart, but the other one felt like it was up my back and in underneath my shoulder blade. It was a painful thing.
When we wake you up the next morning, it will be around 6 a.m. and we'll help you have a wash, and then we'll sit you out in the chair. You will be connected to obviously, lots of wires and lines, monitors, but you'll have 2 of us, 2 nurses to help you get up, sit out in the chair. We can do some marching on the spot, get you doing breathing exercises.
When you're ready to be discharged from ICU, you will come up to Chelmer Ward and be in our high dependency step down bay. This bay has got 4 patients in, and you'll have 1 nurse to 4 patients.
But it's a really quick process. I really couldn't believe from the surgery, from ICU up and then out of bed. And you do find yourself doing it, even though you can't spread your arms wide. You can't push yourself on the bed like that because everything's to do with your chest.
You will still have your PCA, your patient controlled analgesia attached. This will likely stay in until your chest drains have come out. This is because the chest drains are normally what cause the most amount of pain whilst you're in hospital. So generally once they're out, you'll be able to take lots of deep breaths and we'll take that PCA away from you.
The drains, obviously when they pull the drains out, they pulled the first one out, they tell you to take a breath. So I took a breath and they pulled the first one out. It amazes me how you've got that size tube in you. You know, it's just mad. So she pulled that one out and then she said, this one's going to be obviously a little bit more painful, take a breath. And she pulled that one and I could feel it come from my back right the way through. So I was so relieved when that was out. It was unbelievable. Then they put a couple of little stitches in to where they've come and then plaster it over. And then after that I felt quite relaxed because that pain had gone in my shoulder blade. I felt a little bit easier, I could breathe. You know, I just had the oxygen in, that was it. And I could breathe a little bit better.
When they're doing your heart operation, sometimes they have to deflate the lungs. They're a little bit like sticky sponges. Lungs can be a little bit lazy, so they need quite a lot of work to get them back to how they was. So by getting up, doing your deep breathing exercises has shown that it will help you get home quicker.
Breathing exercises after cardiac surgery start really simply actually. They're not as scary or as painful as some people might imagine.
You can't take a really, really deep breath in. You only got like a quarter of breath to get in and out. But when you get up the ward, you're doing them exercises with that little machine. And I feel like it's only probably a week and a half and you're starting to get more air in. Every time you're breathing in, you're hurting anyway because of your chest, what you've just had done. So you are feeling the pain, but you do have to go through that pain to get better.
We want you to keep on top of your pain medication to make sure you can take those nice deep breaths and do some coughing. The physio will come and see you and get you out into the chair every day, and then we'll start to encourage you to walk more regularly, first around the bay and then up and down the ward.
We stay with you, we help you until you're able to be a bit freer, until you're steady and confident to walk on your own. And we do encourage you on the ward to be as independent and active as possible.
You are going to have a bit of a loss of appetite. We really do encourage you to eat because taking in those calories is what's going to help you heal.
We know activity and early activity is one of the main things that helps to reduce risk of complications after surgery. It can help improve your mood, it will promote good circulation and healing as well.
So we'll be sort of organising your medications, getting them up as soon as we can for when you're going to go home. So you normally stay for about 5 to 7 days after your surgery. Some people do go home even before that. That'll all be dependent on what your chest x-ray looks like. We'll be taking regular blood tests, seeing how your bloods are doing and how you're feeling in yourself, that your pain's controlled, seeing how your wound is healing.
They get you out of your bed when you're ready to go, put you into it's like a little lounge area. And then I was waiting in there for them to bring my medication, go through all my medication list, give me, your discharge letter and all that stuff, and then you get told you can go. And then from there, obviously, you can't really walk the whole distance from the top of the wall down to the car park. So they pushed us in the chair down.
Going forwards, you may have some shortness of breath even, but that's often down to having been physically limited in what exercise you've been able to do in the lead up to surgery and also in your immediate recovery from surgery. And it takes time to build that fitness back up.
When you're at home, it's really important to keep an eye on your surgical wound. If you have any signs of infection, such as redness, heat, any pus coming from the wound, it's really important that you get in contact with either one of the cardiothoracic CNSs or the wound clinic. You are not allowed to drive for 6 weeks post-op. You will be able to get the go-ahead to drive once you've come back and seen us in the follow-up clinic 6 weeks after your operation. You can return back to work within 6 weeks normally, dependent on what job you do.
You as the patient need to be on board and willing to be a participant in your own recovery. It won't all just happen, you have to put the work in as well. So follow your exercises, follow your healthy diet, follow everything that you're being told by the team here.
Best thing that the patient can do, or what you can do, is to remain active gently, bit by bit, day by day, trying to do a little bit more. Keep yourself out walking each day just for the sake of walking. Don't be too concerned. There'll be days when you don't feel like you can do that. There will be days when you feel tired and exhausted, and that's to be expected. But in general, as long as your recovery is going in the right direction, you will know that. You will know that you're making progress.
You're in the best place in the world in here. I couldn't fault this hospital, and I couldn't fault the way these nurses and doctors, they were just unbelievable, they really was.